Hi guys. Thank you guys. Good morning. Sorry, we tried to do a Discord thing today and it didn't work out. The setup was a little too complicated, and as much as we tried to troubleshoot everything, things seemed to be working and then they weren't working. So we're here live on YouTube instead. So apologies for that. We'll try to get it all going for you for next time for on Discord. The idea was that people could jump in and we could actually like converse through at least audio or video instead of just me talking into what feels like the air um, and just looking at comments. But we'll try to get that going for next time. So thank you guys for joining in. Let's see. Happy New Year. Happy New Year. Someone wants to know the price of a transplant. The pricing it can change with time. So just best to always ask the office. Let me see if we can. I'll put the email here. You guys can always email my office to ask for pricing. Best non-surgical alternative for a facelift. There aren't really great alternatives because a lot of energy devices create scarring underneath the skin and then makes this future facelift more difficult. So, tastefully placed filler, it's usually going to be the best thing. Uh, Honestly, some people are using like different massage techniques. I think that has some, at least some safety there and can potentially help versus like those high energy devices that can melt the fat away and cause other problems to the face. How important is it to fix the chin implant with the screw? Most of the times, chin implants are not screwed in, they're sutured into place. So it's not terribly important. Of course, it can move, but screw has its own issues potentially too. How regular is PRP required to be effective? This is for Ronaldo. Well, here's the thing, PRP, it's a way to stimulate the hair follicles. It's not a way to prevent further hair loss. So, number one thing is prevention, as I always talk about. So, that's with finasteride, dutasteride. For women, it's spironolactone. PRP as a standalone treatment is usually not that impressive in its results. We like PRP with our surgeries. That helps reduce things like inflammation. Let me just clean my camera here, guys. It helps reduce inflammation and it helps reduce shock loss. But standalone PRP is not my go to be honest. Some people do it, they don't want surgery, they don't want other medical therapy. It's better than nothing. But again, you got to keep repeating it, and clinical results are not terribly impressive. Current best topical treatment for alopecia areata. There really is no topical treatment that's great for alopecia areata. The most commonly used for most people is going to be steroid injections. But if you have like extensive alopecia areata, like in my condition, you'd have to either get on a JAK inhibitor or do nothing. I choose to do nothing, but JAK inhibitors are okay. They're effective, but you have to stay on them. They have side effects like every other medication, right? Blood clotting, potentially blood cancers. Like it can be pretty serious side effects, even if they're uncommon. But I choose not to take it. Is there a way to know how sensitive follicles are to DHT supplements? No, you have to try it out. But supplements are never going to be terribly impressive in their efficacy. But yeah, there's no way to test for like the sensitivity of your follicles to DHT. What should be done first, a facelift or a hair transplant? Well, we had a guy actually who just came in for a hair transplant who had a facelift in the past. If you go to my thumbnails, like highlights on Instagram, and you click on scalp, I think it's scalp number 4, you'll see the series from the other day, earlier this week. Um, we did a hair transplant. The guy had 3 prior hair surgeries and a facelift that we were able to transplant part of his scarring, so that can be good to cover up some of those scars. Bookish says, interested in Lift. Does it cause you to lose your dimples? No, it has nothing to do with dimples. If considering rhinoplasty, which procedure for usually rhinoplasty first, then a lip lift is the way to go. How long after the hair transplant does it last? How long? I'm not sure about what. I'm not sure what the question is. Best treatment for under eye hollows. Yeah, usually it's going to be a lower bleph with fat transfer, honestly. All the other treatments like filler and all the stuff is kind of temporizing and not terribly effective or great because you can get like edema and swelling and you get these eye bags from too much filler. So at some point, you just have to go for the lower bleph. That tends to be the most effective and long lasting. How far are you for appointments for hair transplants? Usually about 3 to 4 months out. You just call the office or shoot them an email. The email is up flagged at the top. Zigzag pattern for hairline. It's okay. I mean, I have my own type of way to design hairlines. Sometimes a zigzag can look a bit artificial too if it's too perfect. So the idea is to have it still be a hairline, but you don't want it to be too regular appearing. So there's different ways to regularize it. Do you recommend topical minoxidil with oral we usually recommend oral minoxidil and oral finasteride, and, feelconfident.com if you're in the States, that's the place to get it, as far as ordering your medications and other hair care products. Does hair thinning reverse without using finasteride? It's not about reversing, it's about stopping further hair loss. So you get on finasteride to prevent further like progression of your hair loss. To reverse it, to stimulate the hair of what you have existing, usually oral minoxidil is the best at that, but there's a whole series of things that could work. PRP, low level laser light, microneedling, all these things. Then, of course, transplant surgery is the most impressive as far as augmenting what's been lost. Someone says they had an aggressive shed when they started finasteride. The problem is none of these hairs come back after 9 months. What should I do? Here's the thing: finasteride is super effective for like 90 to 92% of guys for preventing further hair loss. The rest need either a higher dose of the finasteride, higher than standard dose. So standard dose is 1 milligram. So you might have to go up, or dutasteride, which is going to be the stronger cousin. So if you're still aggressively shedding and you've been on finasteride, it's just not enough for you. So you need something stronger. What age should you notice mature hairline? Different ages. Some people reach, Norwood 6, 7 at the age of 18, and other people reach it, closer later in life, and other people have, progression that just halts after like Norwood 3. Everyone's different. Uh, I just did a short on Maduro. He was in the news, so I did a short on his hairline, and he has a very strong hairline, and he's older. So some people just have good genetics when it comes to their hair. There's no great test to determine if you're truly a responder to minoxidil or finasteride. You can do a lot of genetic testing, but it's often flawed, and you never truly know. I find unless you like just try it and see. And remember, different dosages are going to have different levels of efficacy. Because you could check your like sulfotransferase enzyme levels and stuff like this, but at the end of the day, we don't have too many things that we know like actually work. So it's I think good to just try the tried and true and then see. Matt wants to know what do I think about Zarev Giga sessions. Zarev is a friend of mine, and we were just in Berlin together, had dinner. He's a great guy and he's very talented. He's one of the best in the world. Uh, he has his own harvesting device, and we're working on our own device. And I think without that, it's very hard to replicate these very like large sessions to do them properly. Essentially, what he has, and he just doesn't tell people what he has exactly because he doesn't want to sell it, and he wants to keep it proprietary, which is I respect. Basically, the idea is to go in with a very small size punch, but you need to be able to capture like healthy 3 hair grafts at least. So we don't have punches commercially available that can do that. So Zarv's made his own. We're working on our own to be able to do something like that. So then you can, because if currently if you go down on your punch size and it's really small, you're going to have a lot of partial transections. So the number of hairs per graft drops down. So when people go to like Turkey, let's say they get 4 or 5 thousand grafts in a day, what's usually happening is they're using a very small punch, but they're getting a lot of very like small hairs per graft grafts, right? The small grafts. So you're moving those over. You're going to get, um, you know, a certain number of hairs growing from that. That's not going to be any more impressive than fewer grafts with more hairs per graft, right? So there's no miracle here. But if you can drop down your punch size enough and still have a way of getting those larger grafts, which requires a new technology, then potentially you can drive up the number of hairs per graft and the number of grafts per session safely. So that's what we're working on, and I think Zarev has a solution that he's invented and isn't sharing it, and that's okay. So that's that. What else? But it also is a question on the Giga sessions. Even if you can do it, the question of should you do it, it's more philosophical in that you can transfer like a large number of graphs per session, but again, there's a limited supply. So then it's like, well, if you want to do touch up work or if things don't work out as well the first time, you have less ability to do that because you've exhausted more of the supply. So it's do you want to throw the Hail Mary in a football game and hope that you get a touchdown, or do you want to go 20 yards at a time, right? Like one is more risky than the other, but like if you throw a Hail Mary and you land it and you score a touchdown, like that's awesome. So it's kind of that way. Lots of questions, guys. Let me see. No problem, Matt. How long to see results switching from finasteride to dutasteride after more than a decade of use? No, like if you're breaking through the finasteride and still losing hair and you switch to dutasteride, you should see improved stability within a few weeks, typically. Weeks to months. Used topical Minifin for 3 years, hair started thinning again. Thought about upping the dose, said F it and shave. Turns out it suits me and made me realize I was relying way too much on looks. Okay, that's from Yo Gangsta. Well, that's good. If you're happy with the shaved head, then go for it. That's great. Are you still performing the FUE method? Well, yeah, of course. I mean, that's the primary method that's used in our clinic and most clinics. We still do FUT for the right individual, but like 99% of guys coming in for hair surgery are getting FUE. Sometimes for women, we do FUT. Sometimes if there's an old FUT scar in a guy and it's well positioned and I can utilize it to get some more hair out and still leave the same linear scar, we sometimes will do that, but we rarely default to FUT as a primary surgery for a guy. Choi implanters for hair transplant. There's different ways to do this stuff, right? So this is more on the implantation side. So forceps are the tried and true. We know they work in the right hands. I mean, you need experienced technicians. Choi pens or implanter pens are another way to do it, where the grafts are loaded into the pens and then you kind of inject it. And you can inject it either with a sharp tip or a dull tip. Both work fine. It all works. It's just like what works best in your hands. I prefer to make pre-made sites with very sharp tools that just feels better in my hand, and then that controls all the angles, directions, regularities, all that. And then my team uses forceps to slide the graphs in. I mean, we know it works, but Troy implanters can work too. Horns Woggle wants to know any recs for filling in the beard. Well, you can try oral minoxidil. It'll help to a degree, but uh, and you can microneedle as well. But like the results are just eh. You can get a transplant into it, but the transplant, it's coming from the same general donor supply. So if you ever want to get scalp work done, you have to be careful not to deplete the supply for beard because the beard can consume a lot of grafts to make it dense. Best tips for controlling dermatitis and dandruff after a hair transplant. Well, usually if it's really bad, you want to have it under control before the transplant. But then afterwards, what we do when we notice like some scaliness during the surgery, we usually put people on doxycycline for at least a week. So that's a good way to do it. Ketoconazole shampoo is good. but, like, I would wait 2 weeks after the surgery to start using that. Usually, just mild, like, baby shampoo is best for the first 2 weeks. But but if you need something stronger, like a topical steroid, like shampoo, then better to sort that out with the dermatologist before the surgery, so then you know what to start using if you kind of flare up in the weeks after surgery. Should I increase dutasteride even after lower semen volume? Well, it's rare for someone to need to drive up the dutasteride dose. A standard dose is good at like 98% of men. Um, So it's rare to have to go up, on the dutasteride dose. Some people, we do drive their dose up to get better hair control, but, like, we don't wanna have you suffer from side effects, so it's a balancing act for sure. Alles, no problem, thank you. Skin lightening product to get skin shades even across different body parts? That's not really my, focus, so I'm not really sure what the best thing to do for that would be. Uh, what brand of dutasteride? Dutasteride, usually just generic, is good. Uh, can you do hair transplant on scars after brain surgery? It's a good question, Maria. Yeah, I mean, we transplant scars all the time, and it works. Scars. The thing about scars is that there's less blood flow, so you can't overload it with too many grafts. So, like, usually you have to then do a secondary procedure to up the density a little bit. But we've never seen like no survival in scars. I mean, it always works to a degree. And also, the texture is different, obviously. So you have to be very careful with your technique to be able to properly transplant scar. But it's totally doable. And the nice thing is, once the hair is growing in the scar, it tends to remodel the scar because there's now fresh blood flow into the scar. So as that happens, the actual quality of the scar improves. It's not like you're just masking it with hair. You're actually improving its quality, and that's a really nice thing. Just got a transplant for Benjamin. He was walking in a light drizzle and winds 2 days post-op. Should I be worried? So the way, like, if you lost grafts after a transplant, it's not subtle. It's like you actually get a bright red streak of blood coming down your head, right? Because like that's what happens because it's plugging up a hole. If a graft comes out, it's like this bright. So if you don't have that, then just assume that you didn't lose grafts. Usually, some wind and a little bit of drizzle is not going to do that. Typically, when people lose grafts after a transplant, it's like the actual trauma, like they banged it, they forgot, they went like this, they've hairs on their hands, that's how you lose it. Can you eat after a lip lift? Yeah, of course you can eat. I mean, we don't want you to starve. Um, you can eat. It's soft foods for 2 weeks is the official recommendation from me. But yeah, of course, Lady L, yeah, we need you eating just so that you can heal and recover well. Chest hair, for procedures, we rarely do that. We've done transplants to the chest, but we don't transplant usually from the chest. The hair is very curly. It sometimes doesn't do as well over time, over many years, so we don't use that. Yeah, if you do a transplant and then, like, the question is, do you still need to do maintenance medications after? For most people, yes. For women, if they're just lowering their hairline, usually no. But for guys who have androgenetic loss, I mean, it's kind of short-sighted to just do a transplant and not be on medical therapy because things will change and progress, and you'll have this transplanted hair, you'll have islands of it, you'll have the hair that you've lost around it. You'll have to keep chasing it with transplants, and then eventually you run out of supply, and then it doesn't look potentially great. So, in my opinion, every guy getting a transplant with male pattern loss ought to be on some form of preventative medical therapy. Mike says he's been off chemotherapy for 7 months. How long should I wait to consult for a hair transplant? Um, Definitely at least a year, if not more. And it depends, like, if most of the hair returns and it's just the male pattern loss, then we can transplant it. But I would give it time, year, year and a half, something like this. Best of luck. Anything on keloids? I don't think I've ever transplanted a keloid per se. I think it's better to deal with the keloid first and then consider a transplant. We've transplanted all types of scars, but keloid is a very specific entity. So usually best to deal with that first and then maybe a transplant down the road. Do you think 7 months after a hair transplant, there's still room for improvement on the donor, or is it what it is? For the donor area, 7 months is quite a bit of time, but if there is shock loss, it can take a little longer to return. So I'd give it a full year before you sort of assume that, you have what you have. Nina says she's always had dark circles, hollow structure, I guess around her eyes. Any options other than filler? I don't want any procedure needles. Well, I mean, there's like topical creams and stuff, but they don't really do a whole lot. So usually a lower bleph is going to be the way to go with maybe some fat transfer. If the father of my husband lost all hair by age 40, how much is the risk that my husband also has this condition? He's 30 and his hair grows extremely fast. Well, it doesn't just go based off of like his father, right? So the genetics for male pattern hair loss is very complicated. And, he may or may not continue to lose hair. So, if he has no signs of hair loss, then I wouldn't start on anything, and if he starts to develop signs of hair loss, then you might want to consider some medical therapy first. Horns wobble. Do the feel confident foams and serums help with the beard? Um, not as much to be honest with you. We actually created a beard serum that we haven't released yet, but even that it's meant to kind of soothe the skin of the beard. It's not going to lead to tons of growth. You could try the scalp serum that we just released. It's on the Feel Confident website, and maybe Mark can post the domain for that. But feelconfident.com, the scalp serum has some growth peptides in it, so it might help with the beard, but I wouldn't keep my hopes up too high. But I think it's worth a shot. Not sure if we'll release the specific beard serum. I think the scalp serum, honestly, is a very just good product overall. So you might want to try that out. We have a description on the website of all the key ingredients that were placed into it. We just released it actually like last week. You'll see it a lot on TikTok, I think, eventually, because we're gonna do like a blitz campaign and get people on TikTok talking about it. But it's a great product. A couple different places, and some have their own branded PUE, like micro PUE. How different are various clinics' PUEs? Um, I think he meant to say FUE. People like to kind of coin their own names. I'm guilty of that too. The question is, does it really make much of a difference in how they're doing the actual surgery? These days, the punches for FUE are all based off of a patent from like 2008. So these are just like cylinders, cylindrical, devices that come down on the scalp. So they're not really that different from company to company. We use a Belgian system called the WA from Dr. DeVroy. It's a good system. But like I mentioned, I am working in a stealth project to create our own device that does have a novel technology, but it's in the early stages. So I don't have that much to share about it. But I think it will help improve the field. But most of what's out there is kind of just like marketing hype without actually anyone having something truly different. Most of the differentiators in hair surgery these days, in my opinion, that comes down to taste and artistry, because people can get their hands on similar tech, with rare exceptions like what was mentioned earlier with Zarev having his own device. That's great, but most people just use what's commercially available. Why many Brazilian doctors showcasing special place hair as donor hair? I saw many reels, or is it just marketing? Special place hair. Well, some people will harvest from different parts of the body, but like then you see the results, and it's very curly hair, wiry, super curly hair on the head after that. I don't think that's for everybody. A lot of my and plus the scarring usually is worse on the body because there's less blood flow than the head and neck. But, to each his own. Some people just want to get every hair from their body and put it on their head. But it's just not going to look like scalp hair. It doesn't look like scalp hair. So, you know, uh, I don't love to do that approach, but some people do. It's a one way to drive up the graft count. If you're charging per graft and all you want is to have that graft count be as high as possible, then you're going to look for hair from everywhere. Um, what else? Do 10% or 12.5% minoxidil solutions provide better results than the standard 5? Maybe to a degree, but in my opinion, oral minoxidil that's 100%, right, is going to be, of course, much more effective at a low dose. You do careful planning lip lift, for instance, if person had prior upper jaw surgery and there's scar tissue? Yeah, of course. It's always careful planning for any surgery that I do. Is there a natural way to reduce lip size? It makes me insecure sometimes, to be really honest. Yeah, Nini, there of course is. It's called the lip reduction. So if you search city facial plastics for lip reduction results, you can see some of that. But we do that, pretty commonly with good results. Someone asked me about hurtful palms. I don't know anything about hurtful palms. I'm sorry, that's not my area of expertise. Someone wants to know personal YouTube channel. If we accept requests for minor hair transplants. Short answer is yeah. Like we'll do a minor hair transplant, but remember all hair transplants take time, artistry, effort. Like our minimum price is fairly high, so if someone wants 100, 200 grafts, they probably aren't going to come to us. But sometimes they do, and you kind of get what you pay for most of the time, right? But we don't have like a minimum number of graphs that I have to do. It's just that there is a minimum price for our effort. So something to keep in mind. But yeah, we'll do any size procedure as long as it makes sense. And you know, uh, yeah, sure. You should do the Washington Square Park thing again. I was the ginger guy from that video. Oh, nice, Scooter. Thank you for sharing that, man. It's good to see you on here. Yeah, we've been toying around with the idea of going out more in public and filming stuff. Doing maybe even a live Q&A in public. I don't know, man. You see like I Show Speed doing that in all these countries. I don't know. Maybe it's just it's tough because I operate 4 days a week, and my Mondays are my more flexible day where I can do meetings and go see a dentist if I need to do that or film videos. Right, like it all takes time. So then I'm stuck in the office Tuesday through Friday. And the weekends I try to do family stuff, or in this case, I'm here with you guys. So yeah, finding that time now is a little bit more tricky as we've gotten busier with surgery, thankfully. We're happy about that, but then it's harder to do all these other things. Why is the price difference so high between Turkey versus Korea versus US? I mean, for I think obvious reasons, cost of living is very different, right? So that's going to be the number one. I mean, you can find great doctors everywhere. You just have to pick someone who you trust and who I think has a good artistic eye, and that doesn't has nothing to do with the country. Um, Most of the revision work that I do these days is not revision for like super botched jobs out of random places. It's actually work that was done reasonably well at like good places, like good meaning like known places with known reputations, mostly from the U.S. Um, and then people just want a different set of eyes on it. They want some adjustments. I think more and more people are realizing that we can do the temples really well. So that's a very tricky area, especially as you transition from the hairline into the temples. If you go on my Instagram story, we threw up an example I was putting together for the website. So I just took a picture of like the before and after of a patient who came in just Thursday for his after result. Um, and he looks really, really good and just kind of a representation of what we're capable of. But yeah, that transition zone is very hard for a lot of doctors to get right. And so I do a lot of revision work in that sense. To drink some water. Thank you guys for joining today. Again, apologies on the Discord. That was a fail on our part. we're going to keep trying to get that to work. And next time you guys will be able to jump in. So actually, Mark, if you're in here, can you post the link to our Discord? It's a good opportunity for people to go and join into the Discord. And then once we have everything set up, we'll arrange another one of these, and we'll be able to, do it all through the Discord, so you guys can jump in and can actually hear your voice and maybe even join in through video. That would be really cool. So next time. Pete, again, for pricing, just you can see at the top there, just info at cityfp.com is the goal for wanting to find out pricing. That's where you have to email. Okay. Yeah, you see here the Discord. So go join that. And next time we'll try to have everything set up for it. Do you plan to open cross-country branches, because many people have trust on you, but USA visa is not easy? You mean like in other countries? Well, I'm not sure what we're gonna do exactly, because it for now we have our hands full with one location here. We see people from all over the world, which is great. I'm not sure if one day we'll be in other countries, in other states. Uh, maybe. I think if my technology works and we're able to create a new harvesting device that's truly better, then we'll have to figure out how to get that into more people's hands. I definitely don't want to have a device that's purely just for myself. I believe in kind of democratizing technology and making sure that everyone can benefit from it. But as far as how that structure will look, I have no idea right now. Someone's asking $12.50 per graph normal for Chicago. That's probably more than the average for Chicago, but that's a lot of money. Got to make sure you love their results if you're going to pay that much. I got lucky. I speak Turkish and had a top-notch tech who is conservative with the design. They cannot do temples. Don't let them do your temples. Okay. All right, good. Yeah, temple work is very challenging for sure. Someone's asking, do you feel 2x FUT followed by FUE if needed is still a good strategy for those with diffuse hair loss in 2026? Uh, I don't think it's necessary, to be honest. I think, your yield can still be quite high with FUE alone. Um, Maybe it'll be 15% higher if you do those two strips, but then you've kind of burned a bridge on wearing the back short. So most guys don't want to go down that path. Hair loss vaccine in 2026. Haven't heard of that being even like in the development stage, so I don't think so. Because, so there's different things being worked on now, right? Like, I put out the video on PP405, you guys probably saw that video. There's another one I'm gonna try to film today or tomorrow on, a study out of Taiwan where they looked at what's called monounsaturated fatty acids to try to stimulate hair follicle stem cells. So I'm gonna put out a video on that. I don't know. I mean, to me, I think most of it is for some stimulation, kind of like minoxidil does. Maybe it'll be a little more effective, but it's not truly preventative. And once the hair follicle's kind of been burnt out and the stem cells are not very active, there's not a whole lot to stimulate. There's not a whole lot left to stimulate. So it's kind of like if you think of a factory, and if the factory is still kind of like up and running, and it just needs like some maybe extra fuel, energy, electricity, some parts maybe, and you can get it working again. But if the factory is like burned to a crisp and you don't have a factory left anymore, I mean, just adding in some, plugging in some extra electricity to it is not going to all of a sudden get it to work. So I think that's how we should think of our hair. Eventually these factories burn out, and no matter what you put on there to stimulate, just doesn't do a whole lot. So that's where a lot of people find themselves, and then they try to do all these treatments, or they're hoping there's going to be some miracle cure. And I don't know. I don't see a miracle on the horizon. So I'll hi to my family. Hi, Lily. My daughter is watching from home. All right, guys, got a little bit more to go. I feel bad about the Discord stuff. I wanted to get that going for you today, but it's a complex setup, as it turns out, and it just wasn't working on this computer. So we'll try again. Thank you, Ellie Ethia. Thank you. Okay, thoughts on testosterone. So, yes, for me, I cannot just put out like a quick video, right? Like, I need to go in depth, as you guys are used to that from me. So, we have the Taiwan study that I finally analyzed. I'm putting that into a video next, as far as like new hair loss treatments in that kind of series of videos. The PP405 we've covered. The clascosterone is on my to-do list, but again, I need to take a deep dive. I don't like this kind of surface-based information. I'm going to do a deep dive, see where the latest research is, and then report back to you guys. But it's not something that we're currently using in the practice. Hello, Noni. Can men also face middle parting like hair loss? Yeah, well, some guys, they actually have a part line right in the middle. This is interesting, like the hair divides centrally. It's not a common pattern, but it's there. And yeah, you can transplant it if it's thinned out, but like you always will have a little bit of that thinner appearance because anytime you have a part, that's kind of what happens. So if you have a whorl, for example, like in the crown, that center of the world, even on my daughter, it like looks a little thinner. That's normal. It's because where the hair is changing directions. Some people don't always understand that. They think it's, oh, this spot came out a little bit thin with the transplant. But in reality, it's because the hair changes direction there. It's always going to have that kind of slightly thinner appearance. Uh, Flying raccoon, I'm not gonna have any specific clinics in Turkey to recommend. I think you have to do your research if you're planning on going there. Always look for a clinic that's doctor-led and not like a doctor who oversees 100 cases a day, which exists out there too. A doctor, Matt Dominance and I talked about this in our podcast. Your goal is to find a place that essentially does one main hair transplant a day. I mean, if there's a small touch up in the other room, fine, but it takes a lot of effort and a lot of resources and people to do one hair surgery well in a day, like a larger one. So, if you have a clinic running 5 cases a day, even 2 large cases a day, it's the quality might be affected, it might not, but it might be. So that's really, I think, your goal when you're searching around. I mean, that's like one of the things to look for. Obviously, you have to be really happy with the results. And I find that in analyzing people's results is kind of all over the place as far as like angles changing, the lighting changing, the coloration of the hair, the length of the hair, even from my dear colleagues sometimes. But you know what? I'm not perfect either, right? Like sometimes we try to control for all these variables, and it's impossible to control it for every single patient. But I think when you look through a gallery, you can tell like who's trying to show very reproducible, consistent kind of outcomes where everything is sort of controlled except for, of course, the result of the surgery. Versus when it's all over the place, the way things are combed are very different, and you can't really compare before and after well. So look for that. You gotta I think it's on everyone to kind of elevate their taste. It's like I don't know, for anything like wine, for example, right? When we've whoever has had wine before, when we first tried it, usually doesn't taste very good, right? Like when you first try it, it's like eh. And then you start to try other types and you say, okay, yeah, I can see why this one maybe is more expensive or tastes better than this other one. It's fuller bodied. I can taste some of the berry notes, whatever, but you have to develop that like taste, right? And it's the same for most other things in life because like watches, like at first glance everything looks the same, but then you start to learn all different little nuances and what's handmade and then you start to develop taste, right? So with hair surgery results or results of any plastic surgery, it's kind of the same thing. You need to like work on developing your taste for the different caliber of results that are possible, so you can really know how to analyze, how to inspect the result, so it doesn't just look like, oh, this guy just got more hair, right? Like it's like, okay, but let's look at this element of it, that element, how it seems to lay, like, the positioning. Like there's all these different things. And when people just want more hair, then maybe it doesn't matter where you go because like it's just gonna get more hair if you can't, if you don't have the taste. So, oh, Sean. Oh, Sean, one of my patients. Spoiler alert, extremely happy with my procedure. Thank you, Sean. Yeah, honestly, like it's oh, join Discord. Yeah, Pete. So the update, we've been chatting about it here, is that Discord setup just didn't work on this computer today. So apologies. I think we have to update a couple of video drivers, but we'll have it up and running for next time. Yeah, Discord I think will be fun because you guys can jump in, ask questions more than just like written stuff, because I don't actually enjoy talking out loud to what feels like just thin air. I know you guys are listening, but my preference is to actually interact more. So we'll get that going. Sorry, Pete. Okay, a couple more questions. Let's do 10 more minutes. Okay, Josh, my older brother lost a lot of hair over the years, especially on his crown from the age of 29. Thankfully, he still has a full head of hair at 54 apart from mature hairline. Is this normal? Yeah, some people have like a primarily crown loss pattern. Yeah, if you go to my Instagram stories, one of the results that is going to hit the gallery soon, but we just kind of previewed it in the stories, you'll see a crown result. This gentleman primarily had, just a big bald spot on the crown. He still had some preservation of frontal hair. Of course, it wasn't his original but hairline, but like, it still had some hair here, but this was completely gone. So we did one, 2,800 graft restorative procedure, and there's still room for more. So he might come back for another round. But point being that some people have a crown heavy loss pattern. That's one type of male pattern loss. Hey doctor, my overall hair quality is good. I just have a little hairline recession. Let's say I want to fill it in with a few grafts. Is it possible to get a transplant of 800 to 1200? Of course. You know, if I had to say what my specialty is within hair surgery, it's these kind of finesse hairline procedures, right? Because like hairline work is very artistic to get right, and to make it work with the surrounding hair, it takes a lot of effort and proper vision. So yeah, I mean, what I do is actually start with the site making for those cases. So we actually pattern through. So we decide like how many grafts we need before we go to harvest. So I think there's this misconception that you have to harvest first. So you say, okay, I'm going to do 2,500 grafts today or 3,000 grafts today or whatever the number is, and you get that material. It's what a lot of clinics do, and then you just have to find a way to fit it in. Then that's not the best way to do it, in my opinion. Usually what we do is we create the actual grid pattern of incisions that will guide how many grafts we need. Then we go and get that number from the back with some degree of overage for later fill in. And then we put the grafts in. So we don't want to get more than what we need, especially for a finesse hairline procedure. That's an important point. Ronald, first of all, I love your videos. Thank you. Please help. My hair's falling out incredibly. There's terribly little left. It's thin and weak. I'm desperate. What do you suggest? Would your products help? So, the tried and true first line is going to be oral finasteride and oral minoxidil. You get on those unless you have some allergies to those, which is very rare, or some contraindication, which is also pretty rare. You start those, you ride those out for like 3 months, see how you're doing. Then, depending on your donor supply, you can maybe be eligible for a hair transplant or a few hair transplants. So that's the thing. So don't get all worried, but you got to do something about it. And that again, that's first line, right? Fin and Min is going to be first line. Uh, our products, like specifically our thickening shampoo, conditioner, we have a thickening foam, we have a new scalp serum that you guys should check out. We linked it at the top if you haven't heard about it yet. It's a very nice scalp serum. We have it going out to Italy for clinical testing for like an actual research study soon. But and our shampoo conditioner study is almost complete. So we'll be sharing those results with you guys as well. We have a 4-week preliminary outcome that I believe is on our website now, but the 12-week full study is going to be available in February. And the scalp serum, we're shipping out to them now since we finally got it filled. But it's available for sale and it's a great product. But yeah, you can use those, but that's going to be like an adjunct therapy. It's not like your first, go-to line of therapy. Same with like Nutrafol, same with pretty much anything else, PRP, low level laser light, microneedling, anything like massaging of the scalp, everything else is going to pale in comparison to the efficacy of finasteride and minoxidil. And then you can layer on other things. But don't get discouraged, Ronald. Just kind of, you got to link up with the hair surgeon and let them walk you through the right steps. Someone ethical who's not just going to jump into surgery when your hair is actively falling out. It's not the time to do surgery. You want to do surgery, hair surgery, when things are very stable. Contrary to maybe popular belief where people are like, oh, well, I'm losing hair rapidly. Like, shouldn't I just do the surgery? No, you shouldn't, because surgery is controlled trauma and that can lead to even more rapid hair loss. So, we got to be careful. Watching your content in Turkey, I'm 18, always wanted to have a rhinoplasty, but a lot of people tell me I have body dysmorphic disorder and a rhinoplasty won't make me happy. I'm confused. Well, you gotta maybe talk to a therapist, see what they think, because if people are telling you you have BDD, it might be for good reason. You have to kind of handle the mental health first, and then physical things can be addressed secondarily. But usually I find that if there's one specific thing that, people are focused on, first of all, you're 18, so you might want to just wait, give it time, see how you feel about it in another few years. But usually BDD isn't so much about fixating on one specific trait. If there's multiple things that people just can't stand about themselves and they're thinking about it all the time, that's a little bit more in line with that diagnosis. But if there's also something specific with your nose that no one's seeing, if you're going to doctors, they're like, we don't see what you're talking about, and you're obsessing over it, that could be a sign of it. So, talk to someone, Mo. I mean, it's these are complex topics, like our physical appearance, our psychology, how people view us, all of that is interconnected. And sometimes it's hard to parse out, like, is it really just this trait? Is it, my mental health isn't there? Like, it can be very complicated. Um, and sometimes my antenna is always up for that when I do consultations, because some people, you kind of get a sense that maybe there's something underlying that's just not right. And you don't want to just put them through surgery if they need some other form of assistance. All right, a little water, 5 more minutes. So Rebecca wants to know about Nizoral shampoo. Does it do anything to encourage new hair growth, or is it all hype? So Nizoral is ketoconazole, usually 1%. It's an antifungal, and it also has anti-inflammatory properties. It has a very slight DHT blocking capability, but that's not its primary mechanism. So I like it for dry, like scaly skin on the scalp, like a seborrheic dermatitis. I like that as part of the routine, but it's not like, shouldn't be the primary thing that you use to help you regrow your hair. Sadoxel, thank you very much for the love. Do you think the gut and digestive system affects hair growth shedding? I have gut problems and had hair start falling out. Yeah, I mean, of course, like the microbiome of the gut, the leaky gut syndrome, can definitely have effects on autoimmunity, for example. I'm not a expert in that connection per se, but I know that, some people have talked about doing like what is it called? The gut fecal transplant, right? So taking a pill of someone else's feces, essentially in a pill, digesting that, and then having it sort of retrain your gut to have like good bacteria, and that has helped some people with autoimmune conditions, including hair loss. I don't know. It might be something worth investigating for me as well, to be honest, because I have the alopecia areata, and some people have done fecal transplants for that, which is interesting. Do you recommend an amount of daily sunlight for hair and scalp? I don't think there's like an accepted amount that you absolutely need. I probably don't get enough myself because I'm always stuck inside. But yeah, I don't think there's a specific amount. I mean, I've heard people say 30 minutes a day, but I'm not sure if I don't think there's a really like perfect study on that. Thank you, Bill Bright. Appreciate the words, kind words. Great live stream. Thank you, Barry. Okay, let's see what else. Okay, another few minutes. When it comes to red light therapy, how can you differentiate between the real ones from the dupes online? It's really hard, but like just go with the tried and true companies like Capillus or Iris Store, instead of just buying some random cap online. Look for laser diodes instead of LEDs. They're going to be a little bit more higher energy and appropriate for trying to stimulate your hair than the LEDs. LED is like the cheaper of the two. So laser diodes are what you should be looking for. And usually, the more the better of the diodes. I think it goes up to maybe about 300 laser diodes with some companies. But usually, it's also more expensive as you go up on that number. Okay. Let's see. Can one take dutasteride without a prescription, considering they're not planning for kids and they just want to prevent thinning hair, like recession? Yeah, but you need a prescription. But yeah, you can take it. Remember, we don't start people on dutasteride, guys on dutasteride, because it generally will have a higher risk of side effects than finasteride. So finasteride is our go-to for starting, kind of people off on for male pattern loss. For women, we prefer spironolactone for prevention of hair loss. Sean, how soon can you start red light therapy after a transplant for maintenance purposes? Usually, I recommend 2 weeks. Is there any benefit of taking Avodart over generic dutasteride? No, I don't find that there is, to be honest. I'm scheduled for a lower bleph with fat repositioning and skin pinch. I did get an oculoplastic surgeon. Can the fat repositioning create a bump between my cheeks and eye? She's also doing canthoplexic. Uh, yeah, the short answer is yes, it can. I mean, that's one of the risks of um, a lower bleph. You could get a little bump that just will be there, but there's usually ways to improve that with steroid injections and such. But talk to your doctor about it. There's always going to be a whole laundry list of potential risks of any surgery. Any on and off cycle for Is there any on and off cycle for finasteride, or you should take it throughout? I usually recommend throughout. There's some place, like I know this one team out of India, put people on it for like 6 months and then off for 6 months. I don't know. I don't like to play this kinds of games with the body, so I'd rather someone take it like every other day or every third day, but take it consistently rather than 6 months on, 6 months off. What's your diet? Well, I appreciate that. My wife cooks a lot, so that's why my diet is good. What labs do you recommend for getting for hair thinning and excessive breakage in a 25-year-old female? Dermatologist prescribed beta cap scalp solution, but it's no improvement. Yeah, so for women, the hair loss can be sometimes more complicated than for men. So we do have a panel of blood work that we usually will obtain for female hair loss, uh, especially one that doesn't fit exactly with female pattern loss. And that will include some hormonal testing. It will include vitamin D, iron, ferritin, and a thyroid panel. That's usually like pretty standard to see if there's any other underlying cause. Someone wants to know what my opinion is on clavicular. Um, there's a few shorts that one I filmed and one that I'm about to film, reacting to some of his shenanigans online. Um, he's just a young guy going around and telling people that they're ugly. So I don't really subscribe to that. I think he's informed on certain topics, but I don't like his approach of going around and making people feel bad about themselves. So I hope he does a reversal on that type of approach. All right, guys. Any other questions? Any way we can estimate when our baldness gene will switch off or slow down? Not really. Usually, accelerated loss for guys occurs from around ages 25 to 35, and then it tends to slow down. But even if it's going at a slower pace, like you're still losing hair. So it's hard to know exactly when that will all stop. Cool. Are you more comfortable prescribing dutasteride now than before? Or any new high quality? Well, we've always been comfortable prescribing it. We just use it when it's necessary instead of starting everyone on it. Well, for Michael, if you got some side effects from finasteride, you should consider coming down on the dose. Hello, Alan from Colombia. Okay, Troy, hello to you too. Guys, thank you so much. Again, apologies on the Discord issue this morning. Um, we hope to get it up and running for next time. And thank you so much for joining me. It's always fun to field questions and hope to chat with you guys again soon. Again, we have the new scalp serum available at feelconfident.com, and it's a great product. I'm hoping you guys can check it out. And we will do this again soon. Take care, guys. Have a great weekend. Bye.